Hypochondriasis is excessive worrying of having serious illness even tests are normal. That's the most important characteristic. It is also known as illness anxiety disorder. So, first and most important is that unreasonable worrying about having a severe illness. Second is excessive medical testing. Such people worrying about having very serious illness such as, for example, multiple sclerosis, schizophrenia, Parkinson's disease or Alzheimer's disease, and they testing medically. Even tests are normal, they continue medical shopping and they visit to different type of doctors. So first is unreasonable worrying about having an illness. Second is excessive medical testing, and third important condition is misinterpretation bodily sensations. So such people misinterpret, for example, muscle twitching. It's normal. Many cases it's normal, but sometimes it can indicate some disease, for example, amyotrophic lateral sclerosis, and even mild and very unnoticeable muscle twitching can be reason for such people to worry about amyotrophic lateral sclerosis. So that's misinterpretation bodily sensation. Or, for example, fast heartbeat can be misinterpreted as a cardiac problems and heart problems. And here we have vicious cycle, and I will tell you it will start trigger. For example, imagine 35-year-old accountant woman, and she has some mild tremor during typing or doing his households, and she noticed this mild tremor, and she remembered that this tremor is caused by Parkinson's disease. It's trigger. First was trigger. Even tremor can be caused by fatigue, for example, or caffeine, or different types of conditions. This woman still focuses on Parkinson's disease and starts cognitive appraisal. It means this woman starting reading about Parkinson's disease in the internet, and she's collecting lots of information about Parkinson's disease. So she considers only worst case scenario, and then confirmation bias. Confirmation bias means that this woman only chooses information which confirms Parkinson's disease. So if there is that, for example, low blood glucose level can cause mild tremor, fatigue can cause mild tremor, caffeine can cause mild tremor, but women will choose only evidences which confirms Parkinson's disease and ignores other causes. That's confirmation bias. And after this happens behavioral response. Behavioral response is this woman will schedule visit with different types of doctors and goes with one doctor, second, third, and it does not matter if this doctor is saying that she is healthy, she's still trying to investigate her condition. Even blood tests are normal and different types of imaging tests are normal. She still tries to make new tests or try again same test. It's behavioral response, and sometimes this behavioral response can be opposite. For example, women will avoid to typing because she's afraid this tremor, and she avoiding such behaviors where she can notice this tremor. And after this there is feedback loop. It means that after these behaviors this woman will be afraid, anxiety, and because of anxiety she starts noticing new symptoms which further confirms her initial diagnosis, initial false diagnosis of course, and it is feedback loop, and it only strengthens this trigger, and then new triggers occur, and woman says yes, I really have Parkinson's disease. That's hypochondriasis. And hypochondriasis have two types. First is care seeking type, that people seek medical care and they visiting to different types of doctors. And second is avoiding type. Avoiding type is so afraid that she will not go to doctor because she is sure that if she go to doctor will confirm this worst case scenario. What is average age of diagnosis of hypochondriasis? It's early to middle adulthood. It's more pronounced and more common among women. It affects around 5% of world population. Actually, it's huge number, and it increases medical expenses by 10%. So unnecessary expenses is 10% on medical field because of hypochondriasis. What is treatment? First line treatment is cognitive behavioral therapy. Cognitive behavioral therapy looks like, for example, if I wear glasses with tinted color, for example green, I see everything in green color, and I should remove these glasses to look world as it is, or real world. It means cognitive behavioral therapy. It's idea of cognitive behavioral therapy to look at reality as it is. And with cognitive behavioral therapy also there is fluoxetine, selective serotonin reuptake inhibitor or antidepressants also effective, and average effectivity of these treatments are 70%, sometimes higher but sometimes lower also. Second line treatment is benzodiazepines, but benzodiazepines generally is not recommended because of their dependency and side effects. So it's second line treatment. And what is prognosis? If we say about prognosis, if treated, prognosis generally good, but this condition still chronic condition and usually lifelong. It does not affect lifespan of person, but it can importantly decline quality of life of persons. That's why it's important. That's all I wanted to say about hypochondriasis. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.